morning, ladies and gentlemen. Maybe if we can just be seated before we start now. And on behalf of the conference organizers, let me just apologize for starting 7 minutes late. We're just trying to get people in the room. My name is Mbuyelo Ngango. I'm currently the executive manager at the National Research Foundation, responsible for a portfolio that manages all the funding provisions within the NRF, the postdoctoral fellowships opportunities, as well as the instruments that talk to issues of emerging and early career researchers. Today, I want to welcome you to this second conference on Equitable Partnership, which is being hosted by the National Research Foundation, the Royal Society, as well as the British Academy. Just some few housekeeping rules. All plenary conferences session will take place in this very same room that we're at. Sessions blocks have been organized into thematic strands. Session locations also are indicated in your conference programs, and each room is also indicated when you go to your programs. For those who will be doing poster presentations, you'll be required to display those posters at the exhibition hall, and this will start from the first coffee break today and throughout the rest of the conference. Tomorrow, which I think is the most exciting day, will be dedicated to a session where the poster presenters will be expected to stand next to their posters to then interact on the work that they have done. And the most interesting part for me is that there will be an opportunity for us to vote for the best poster presentation. Let me also emphasize that the members of the National Research Foundation, the Royal Society, as well as the British Academy are available throughout the conference at registration desk if you have any questions or if you want to bother them with anything. The National Research Foundation, as we all know, is a funding agency of government that promotes research and innovation across the whole country, internationally, and together with research institutions, businesses, industry, and international partners, where we build bridges between research communities for mutual benefit that contributes to national development. The Royal Society is an independent scientific academy of the United Kingdom dedicated to promoting excellence in science for the benefit of humanity. As an independent fellowship of distinguished scientists drawn from all areas of science, technology, engineering, mathematics, and medicine, the Society has played a part in some of the most fundamental, significant, and life-changing discoveries in history. Our fellows, the people we fund, continue to make outstanding contributions to science and help to shape the world that we live in today. The British Academy, as the UK's National Academy of Humanities and Social Sciences, is committed to advancing global partnerships that enhance both research excellence and mutual benefit across diverse institutions and nations. From artificial intelligence to climate change, from building prosperity to improving the well-being, to today's complex challenges that can be resolved by deepening our insight into people, cultures, and society. They invest in their researchers and projects across the UK and overseas, engaging the public with fresh thinking and debate, and bringing together scholars, government, businesses, civil society to influence policy for the benefit of everyone. The first conference, which was hosted last year, was a culmination of a series of 5 global workshops which were hosted and facilitated by the British Academy in Brazil, Kenya, South Africa, Malaysia, and the UK between July and November 2024. The initiative was funded by the UK government's International Science Partnership and Fund, managed by the Department of Science, Technology and Innovation, bringing together more than 200 stakeholders. The first conference enabled dialogue across geographies and among all stakeholder groups. It concluded with a call to action on equitable partnership, and that's why we are here today. A commitment to take forward a series of concrete tasks towards more equitability. This conference today follows from a reflection and work of the first conference, which was hosted in February 2025, towards efforts to foster more equitable approaches within the field of international research collaboration. Ladies and gentlemen, now that I've done with all of that, the most exciting part, let me take this opportunity to introduce our keynote speaker, Professor Quarraisha Abdool Karim. She's a South African epidemiologist who has made seminal contribution to AIDS research that has highlighted the disproportionate burden of HIV in young women in Africa, demonstrated that antiretrovirals prevent sexual transmitted HIV infections and genital herpes in women, that has informed international and national guidelines on HIV prevention. She's an associate scientific director at CAPRISA at University of KwaZulu-Natal, a professor of clinical epidemiology at the Mailman School of Public Health, Columbia University. She is currently the president of the World Academy of Science, known as TWAS. She's a member of the US National Academy of Medicine, American Academy of Arts and Science, and a fellow of International Science Council. Also, she's a member of the African Academy of Science, Academy of Science of South Africa, and most importantly, for this meeting, she's also a member of the Royal Society of South Africa. We are delighted, even if I must speak on your behalf, we are delighted, Prof, that you are able to join us today to then tell us more and share your knowledge on equitable partnership in global research and from principle to practice. Ladies and gentlemen, can we please welcome Professor Karim to stage.
Greetings, friends, colleagues, ladies and gentlemen. It's a real honor and privilege to be here this morning to address you at this wonderful gathering to discuss equitable partnerships and to take the discussions and conversations that we started to the next level. I want to start by thanking the British Academy, the National Research Foundation, and the Royal Society for the honor and privilege to address you this morning. I'm going to, by way of overview, talk about three things: why global partnerships matter at this point in time. The second is around equitable partnerships, and particularly drawing on lessons from recent pandemics. And this will include HIV, COVID-19, and the infodemic. And then to touch on some of the new paradigms of partnerships to ensure prosperity for future generations. So I don't think I need to remind this audience how important science is and how important truth is. So what we need at this conjuncture is science that preserves this legacy and shared heritage that we have inherited, and that's premised on science as a public good, and the hope that science brings for today and for tomorrow in terms of uniting rather than dividing, in terms of serving all of humanity and leaving no one behind, and science that keeps us moving forward even when political relationships are strained. Now, I think most of you in the room are familiar with the 5 big challenges that are facing us. And we may have worked on different parts of this at different times, but at this conjuncture, what we're seeing is a convergence of all of these. And you'll be relieved to know that I'm not going to cover all of it. I'm just going to focus on pandemics and the infodemic. But I also want to underscore the importance of what member states committed to, which is the Sustainable Development Goals. It's an important 17 goals that provides a solid framework to address the many challenges that underpin and underlie inequities and inequalities within and between countries. And while the midterm review doesn't bring us good news, we've regressed on the little progress we've made. I think this decade that we are in, with the Secretariat support from UNESCO, the International Decade for Science for Sustainable Development, I think is a reminder of how important our roles are in terms of using science to promote and advance the Sustainable Development Goals. I'm going to touch on infectious diseases because I think for many years, infectious diseases have been seen really one of those things that's a challenge for the global south. And I think this most recent pandemic, COVID-19, has reminded us that epidemics and pandemics are no longer threats just for the global south, they are global challenges. Not only are they health challenges, but also they pose challenges to the socio-economic fabric of our societies and our continents and the globe. Again, we are in a new and unprecedented era. And I would add that adversity is not something new. What we are experiencing right now may be unprecedented, but humanity has faced adversity in the past, and we have survived. If anything, we've grown stronger. And it is in times of adversity that how we respond actually shapes how we survive and how we flourish. And you are in Africa, and I want to use the example of the aloe. It is a succulent, and that succulent really thrives, like most succulents, in droughts and the harshest conditions. Not only does it thrive, but it actually flourishes because the most beautiful blossoms and seeds are laid during these times. So if you want inspiration, anyway, nature and the succulents are important. But I think these complex challenges are unprecedented and of significance because they combined pose many planetary and human security challenges. And this is why international cooperation becomes essential, because as we've learned with infectious diseases, a challenge in one part of the world very quickly escalates to become a challenge in the entire world. We've seen a rise in geopolitical conflicts and sanctions that go with that. And what that results in, besides the instability in those countries, is movement of large numbers of people. In fact, today we have more displaced populations than we've ever had in our history. These pose problems in terms of shifting priority setting, and also resources increasingly become scarce and competition increases. There are also, and I know tomorrow's plenary speaker will talk to you a lot more about AI, so I've tried not to bring too much of AI in. I mean, it's an exciting time and opportunity for leapfrogging us in so many ways, but it also poses a threat. And in this particular context, it's the only time where we've had a technological advance where not everyone is benefiting equally and where there isn't the same amount of transparency as we've had in the past. And I want to add and conclude in this particular slide by saying that while we have common problems, the solutions are not necessarily the same everywhere and for everyone. So by working together, we can combine our efforts and collaborate to find solutions and on-the-ground actions that can help us overcome complex challenges. So this moment in time is probably, just to borrow from the World Economic Forum, the most complex and consequential moment we're in. Science is becoming increasingly global, but benefits remain uneven. And an important challenge that we have is trust in science and institutions. They're all coming under immense pressure. And equity is no longer a moral add-on. It shapes impact and effectiveness, and in short, it is a strategic investment that we all can make. So I want to move on a little bit to effective and equitable partnerships. And I want to put some of the principles and remind you of that. It's premised on mutual respect and trust. What's really important is that when you have a partnership, that each partner has to make a contribution. And while contributions initially may be unequal, we have to constantly work and strive towards equity. And training and capacity building, filling skills gaps are some examples where we can start to almost immediately narrow those gaps and enable the partnerships to thrive and flourish. Importantly, when we come together as partners, it has to be more than what we can each accomplish on our own. Because if we just add the two, we're not adding any value at all. But as we think about outputs that come out of partnerships, we have to ensure, one, that it brings added value, but also that the benefits are shared. So here we are in this moment where we need solutions to complex challenges, and that we have to remind ourselves we're interconnected and we have a shared vulnerability. And that the type of science we need to be generating is not what we've been used to in terms of inter- and multidisciplinary science, but we have to take the science to a new level. And that's what is possible when we have effective and equitable partnerships. We have a shared vision and unity of purpose, science that benefits all, and I think we have some progress on some of these fronts. And I think we also need to be expanding traditional partnerships between scientists to make it an all-of-society approach where we bring in industry, we work closely with governments, and most importantly, this science is to benefit people, and the most vulnerable as a priority, and they have to be part of this journey from the very outset and part of where we go. We don't find products and solutions and then try and make it and introduce it into communities. So partnerships bring a new perspective to the challenge, and to avoid a crisis, we do need to act differently. And investing in strong research institutions and strengthening service delivery systems towards achieving and attaining the Sustainable Development Goals is not a luxury anymore. Just to summarize, some of the benefits of investments in partnerships and capacity building include pooling expertise and resources, collaborations to enhance responses, enhance global security and stability, economic and technological growth, and importantly, sustainability and resilience, particularly towards ensuring that all nations can sustain their own development, reduce dependency, and notably be resilient in times of crises. I want to draw the distinction between partnerships versus collaborations. So think about partnerships like a lifelong commitment to marriage or to a person. And it comes with good days and bad days. You don't just have highs, and when it's lows, you say goodbye. So this is really the shape that programs and systems approaches require. Collaborations, think about it like a fling. It's here today, gone tomorrow, very short term, and more conducive to very small projects that have a beginning and an end. But I also want to underscore that while we are here talking about science, that we have to move beyond, and science partnerships and science diplomacy, we have to move beyond partnerships and interactions and communication between scientists, governments, and policymakers to really grow that interface between citizen engagement and citizen science. We also, being in Africa, want to use another concept, which is to think about ourselves, not so much about me, but about me in the context of a bigger community, me as in the context of everything that allowed and enabled me to be here. And that's captured in a concept called Ubuntu. I am because of others, to paraphrase. And when we think about solutions as we gather here from different continents, that we have to go back to an adage that we had in the 70s, which is about thinking globally but acting locally. And this becomes even more critical at this moment in time. We need to underscore again the need to diversify our allies beyond national governments, philanthropy, industry, and local communities. But also, as we think and we act, we need to be much closer to citizens and their critical needs. And that can be done locally, even though you can generate knowledge of global relevance. So, by now, you've grasped this is a strategic necessity. It's not charity, it's not generosity, it's not a luxury. South-South and North-South cooperation are creating new models of scientific exchange, and we're seeing increasingly the emergence and establishment of regional networks of excellence across developing countries. We're seeing sharing of experiences and solutions to common challenges. And what we see, importantly, is providing opportunities to scientists in the global South as a forward-looking response to a more complex future. For equitable partnerships, we need time, we need trust, we need institutional memory, and we need local leadership with real authority, not somebody there who is just specimen collecting or data collecting. It's authority to know what the issues are, and that's really important. And as we move from principles to practice, we need to take a long-term view, because true partnerships are not built overnight. It takes time, and our traditional grant cycles are too short. And so we have to be thinking about how we make calls, how we make awards for projects, but how do we embed this within communities and public institutions? How does our response evolve to new evidence and context? And how do we ensure shared ownership of both successes and failures? What is often underestimated as we think about partnerships is the time required to build and sustain trust, the costs of partnership maintenance, misalignment between incentives in funding and promotion, and the fragility that's introduced when you have rapid leadership turnover. So where change is both possible and necessary is in funding models that support long-term engagement, review processes that recognize partnership quality, career pathways that value collaboration, and regional platforms that support South-South exchange. And I think we all need to appreciate, understand, and grasp that what we have right now is a changing narrative where global South scientists from low middle income countries are rapidly shifting from imbibers to producers of knowledge. And I'm going to share that with you. But before I do that, there are many academies that are reflecting on this challenge that we are here in the next 2 days to deliberate and reflect on. And these include who sets the agenda. So that defines what the priorities are, how the calls are, how the questions are framed, how partnerships are governed, and how trust is built and sustained. And here we're talking about leadership, reciprocity, and long-term commitments. In terms of governance, we're looking at incentives, authorship, and accountability. So I'm going to move now and share a few examples to show this is just not me talking in abstraction. I want to give you some concrete examples where some of what I've shared with you has been translated and to reflect on those. And there are many partnerships and collaborations that have resulted in calls for joint and collaborative applications. And I'm just going to flag one, which is the BRICS research funding calls. And even though it's restricted to a few countries, it's now increased in number. What's important about the BRICS call is that the countries who choose to collaborate, their governments, through their ministries of science and technology and innovation, invest their country partner contribution to that collaboration. So if, for example, India, Brazil, and South Africa decide to have a common project on viral diversity in terms of HIV, then those three partners will sit and figure out what are the questions, how they're going to do it. But the funding for the South Africans come from the South African government. The funding for the Brazilian scientists come from Brazil. And likewise, the funding for the Indian scientists comes from India through their various research and respective research mechanisms and platforms. So now I'm going to move to pandemics, and the first one I'm going to touch on is on HIV. And some of you will remember this, and I think some of you may be too young to remember in the early 80s when we first started to hear about a new disease in gay men. And shortly after that, we started to learn about this new disease that was also in Africa. In fact, so much so that Africa was so heavily burdened by this that 70% of the global burden of HIV infections were in sub-Saharan Africa. And what we were seeing in those days was death and illness. And not just death and illness. I mean, that's something we all like. Certainly death, we know we guaranteed. The question is when. But here, when you see young people in the prime of their social and economic period of their lives getting sick and dying, it's quite devastating. And we saw how Nobel laureates François Barré-Sinossi's discovery of HIV put a causative organism there and enabled the diagnostics to emerge from there, enabled therapeutics and what we have now as triple therapy to emerge, and also a whole lot of options to prevent HIV infection. Today, we still don't have a cure or a vaccine, but what we do have is AIDS has been transformed from an inevitably fatal condition to one that's chronic and manageable. But it took a long time for that to happen. So firstly, by the mid-90s, we heard about triple therapy. But it was only available to those who could afford it. It was expensive, it was unaffordable, it was also inaccessible to people who needed it most. It took the International AIDS Conference being hosted in Durban, South Africa. For those who don't know Durban, it is, according to Time Out, one of the top 14 cities to visit in 2026. It's also a city where I come from, on the east coast of South Africa. So we hosted the 13th, it was the first time that the International AIDS Conference was hosted in a developing country and coming face to face with AIDS and its devastation catalyzed two important initiatives. The first was the US Presidential Emergency Program for AIDS Relief, PEPFAR, and the second was the Global Fund for AIDS, TB, and Malaria. In the past 20 years, we have seen how global solidarity and investment from one country and generosity from one country has led to the change. And I'm getting ahead of myself, but I'm going to just go back a step and come back to the significance of this moment and PEPFAR and Global Fund for AIDS, TB, and Malaria. But around the same time, the NIH put out a very unusual call. And this call, traditionally, when the NIH, the US National Institutes for Health, put out an RFA asking for submissions from people, it would always be a US scientist as the lead investigator. And they may include people from the Global South as potential partners, depending on the question they're asking and what is being done. The NIH did something very different with this announcement that it made in 2000. It was called the CIPRA grant RFA. It was a program grant award, one. Two, called the Comprehensive International Program for Research on AIDS. It specifically excluded Americans as PIs, but asked the local scientists that were bearing a high burden of HIV to respond, and to respond with what they thought was the highest priority questions for their countries. Okay. Completely turned how calls are usually made on its head. So this is a good time to introduce my partner in crime, who is my husband, and also we've worked together for the past 40 years. So whenever I say we, I'm talking about the royal we. But I'm going to extend that royal we to not just Slim and myself, but the 300 staff that we have working at our research facilities and many, many collaborators that we have around the world. And most importantly, the volunteers who take part in our research from different communities, rural, peri-urban, urban, etc. So our grant application focused on the two highest priorities. And I don't have time to go into all of it. In the Q&A or during coffee breaks or whatever, you can talk to me. One of the biggest challenges that we had was, one, South Africa has less than 1% of the global population, but is home to 20% of the global burden of infection. Why are people dying? The most common opportunity with advancing HIV disease was TB. About 70% of people with advancing HIV disease were presenting with TB. And case fatality rates, if you had HIV and TB, was very high. Second challenge was preventing HIV infection in young women. And we see that underpinning the disproportionate burden of infection in young women 15 to 24 years is power disparities. And we can talk more about that. And then more recently, we've been talking about COVID variant. But we put this grant application in for these two challenges facing us. High deaths from HIV, TB, and preventing infection in young women as an important intervention to break the cycle of transmission and change the trajectory in terms of new infections driving and continuing to drive the epidemic in sub-Saharan Africa. So one of the frameworks that we used for assessing our research was to focus, you see this logics framework that I have here. A is what impact is our research having on policy or practice in terms of policy deliberations, policies developed, and programs and how services are being delivered. The second is in terms of generating new research directions. And the third is elevating the country's stature in science. And ultimately, all of this is towards planetary health and future generations having a secure space. Next, we put outcomes. And here is the traditional citations, science citizenship in terms of belonging to various science academies, the external awards and accolades, which is not why we do the research, but it's a recognition of excellence. And then how are we communicating our science to the public? Most of what we do is using public funds. And so what do we do, and how do we use science for advocacy efforts? And the third aspect that we look at is outputs in terms of new scientific discoveries and findings, journal articles, books, patents, trainees, and graduates. So this output versus outcome versus impact is really important in terms of capturing the quantity of products in terms of innovation, outcomes that are coming out of the activities and outputs, which reflect this quest for excellence, and largely what is the impact and what are the changes that result from outputs and incomes. In other words, how are we changing the world? And I want to just share one slide with you, and you can do a Google search and you can get all the scholarly contributions you want. But for this one, which is impacting on health by reducing HIV/TB deaths, our clinical trial published in the New England Journal of Medicine demonstrated how the timing of antiretroviral treatment in HIV/TB co-infected patients lowered mortality rates by 56%. And just in South Africa alone, since these results came out, it's had a substantial impact in reducing deaths. This data was used by WHO to craft the rapid advice, subsequently used to develop guidelines. And anyway in the world, if you have HIV and TB, these guidelines are used to treat patients with HIV and TB. Our work has also impacted at another level. So in 2016, Secretary General Ban Ki-moon hosted a high-level political meeting on AIDS, and the declaration on ending AIDS as a public health threat was adopted by member states in 2016, ending AIDS as a public health threat in 2030. There was a satellite session that preceded that meeting to gather all the scientific evidence and the rationale for this 2030 goal. And that's my husband, Slim, and I in the UN Security Council at the time this gathering happened and where the announcement was made. And then the other picture is with key scientists where the scientific deliberations preceded this declaration. We have also provided high-level science advice and co-chaired strategic meetings for various UNAIDS executive directors, including Michel Serebi and the current executive director, Winnie Byanyima, and meetings to define measurements and metrics to know how we are on track to meet these 2030 goals. Many WHO guidelines for HIV and TB, including for prevention. But I wanted to share that this knowledge is generated in partnership with community and health services. A strong principle that underpins our response to AIDS is working with community, not on or for. The second is that we've built research infrastructure adjoining healthcare delivery facilities, and that includes hospitals or primary healthcare facilities. And as I mentioned earlier, they are in diverse settings ranging from deep rural to peri-urban and urban settings. But most important is our investments in the next generation of science leaders. And this is just a selection from over 1,000 students that we have supervised, from first-year medical school, master's, doctoral, postdoctoral students. And this is where my hope lies, that in all these complex challenges, it's not me that's going to solve it. It is all the investments we make in young investigators wherever we are. So I want to talk a little bit about publications, because in partnerships this comes up a lot. And the way we do this is the top 4 journals for what we work in and publish. The 2 basic science journals, Nature and Science, and then there's more clinical journals, for example, New England Journal of Medicine and Lancet. And what we do is separate out, and you see this has to be done over a period of time to get sufficient numbers and enable this kind of analysis. You can't do it for a short period. And so this is for the period January 2010 to March 2025. We differentiate between where it's CAPRISA-led, because we're also good citizens and participate in multi-center studies. And then we look at the more general journals in infectious diseases and AIDS, and we also look at the impact factor of journals. And the line that I want you to focus on is the bottom one. It's, if you like, a publication incidence rate, which is how often do we publish in these journals. And in the NEJM, it's every 5 months. In Nature, every 2 months. In Science, every 6 months. And in Lancet, every month. So this is the whole stable of Lancet journals, and associate the same with Nature. So this is telling you about basic science knowledge we're generating, but also how we're taking that basic science into clinical trials. And so this is how you are looking at a continuum of knowledge generation, if you like, that interdisciplinarity that we spoke about, and the multidisciplinary type research. And it's also showing that CAPRISA scientists are leading where they need to lead, and they're also partners where they need to be partners and collaborators. So this is where I started to get ahead. When the Global Fund was set up and PEPFAR, a single country, the US investment in 15 African countries was such that we were able to move within a very short space of time to put, at this point in time, globally, about 32 million people on triple therapy. And the face of AIDS has forever changed. On prevention, we've been less successful. And so we have to take a picture at a glance. We today have about 41 million people living with HIV. We still see about 630,000 HIV deaths, but the most concerning is the 1.3 million new infections. So I put this slide up as a reminder that AIDS is not a yesterday problem. It's still with us. We still have challenges in terms of keeping people on treatment, putting everybody who's infected on treatment, but importantly on preventing new infections. Today, we have enough technologies and tools to end AIDS as a public health threat in 2030. And we are at an important crossroads at this point in time, and I'll get to those challenges in a bit, but 2 out of 3 new infections that occur globally, of the 50% of infections that continue to take place in sub-Saharan Africa, is in adolescent girls and young women. But what are important takeaways from the HIV epidemic? The first is about mutual interdependence and shared responsibility, and particularly the importance of global solidarity. And global solidarity through these 2 mechanisms was essential for access to life-saving medication. We saw it as a shared responsibility. Countries where individuals saw caring for fellow citizens as important and do better than those where individuals focus on themselves first. And a recognition that no one is safe until everyone is safe. The investments that were made in responding to the HIV epidemic in terms of research capacity and health system strengthening in Africa alone is quite phenomenal. In fact, when faced with COVID-19, this was what enabled us to pivot so rapidly. And in addition to that, there were other platforms in place that also enabled this. So what did CAPRISA do in addressing the greatest pandemic of our time? Well, we, through our experience and expertise, were able to map out an 8-stage COVID response for South Africa that we shared in the pages of the New England Journal of Medicine that enabled other countries that were grappling with what to do to use and adapt it. We reminded people in the pages of Science that COVID was happening in the midst of TB and HIV, and that we could not stop those services while we continued to grapple with the challenges of an emerging COVID pandemic. We provided, using some of the sequencing work we had in partnership with Tulio and Chris, some of the early descriptions on the impacts of variants at a time when most of the world was not monitoring the evolution of SARS-CoV-2. We collaborated on several high-impact studies, but we also did and shared the first epidemiological analysis of Omicron. Some of you will remember that when South Africa had the press conference together with Botswana to share this, the whole southern African region was slapped with travel restrictions and bans. So important lessons there. But we also saw how the variants changed endgame scenarios. And you know, with all epidemics and pandemics, we need an endgame. We had the vaccines. This was about public communication during the pandemic, but also recognition that previous investments in malaria, in TB, in Ebola, cholera, all contributed cumulatively and collectively to generate those 6 vaccines that we saw in less than a year. But while we came together to generate the knowledge, access to that knowledge and benefit to it was uneven. Even South Africa that did the trials had to join the end of the queue, and there was big secrecy about how much you had to pay, even though you contributed to proving the efficacy of those. And these reflect uneven financing, supply chain dependence, fragmented regional coordination, but also where we shared data without benefit sharing. So what are some key lessons from HIV and COVID? In HIV and COVID, we saw science transformed in various ways. With paywalls from the journals coming down, there was an unprecedented number of articles every day. But there was also quality issues and challenges in terms of what was being published. What we do know in pandemics and times of crisis, that scientific evidence has importance in decision-making by providing guidance and challenging mis- and disinformation. Forgot COVID happened during first pandemic when we have social media platforms, and I'm coming to infodemics in a while. In AIDS, we had many, many political challenges. In South Africa, we had to deal with our second democratically elected president. In the US, there was Reaganomics, but ultimately, scientific evidence provided a path forward through triple therapy. In COVID-19, we've moved on beyond the political machinations, and as science develops and new solutions come, we then have to deal with the access issues. But the HIV and COVID-19 pandemics have provided us a new lens for the nexus between science, politics, and global health as we pursue the path to sustainable development goals. I'm going to move now to the third pandemic, which is the infodemic one. And we all know that information is power. And disinformation and misinformation is abuse of power. And I'm drawing on many sources here. But to remind you for the 5th time, in a very complex world right now, and there are complex and interconnected global risks that we're not sufficiently prepared for. There are vulnerabilities from technological risks, societal risks, environmental risks, and political risks. And what we have, infodemics, which is polarizing society into us and them. And what we have, mainly through social media platforms, is amplification, not accuracy. Most recently, we've seen this in the context of Alex Pretty's death. These video and visual images that show what happened, and the narrative in social media is completely contradictory to that. Minimal fact-checking, no editorial quality assurance, and anything goes from people and bots. Our constitutional parameters that put guardrails for what is decent and what is indecent has gone. And then you don't know if it's people or it's machines. And in this shroud of anonymity, anything goes. And we're seeing how things target specific groups, and we can see how hatred and divisions are being fostered. We've seen a new category of professionals, an influencer. People are generating income from posts, and it's not just those who are promoting particular beauty products, but we've seen how medicines have been sabotaged and hijacked in this context. You can take images of people who are trustworthy and superimpose nonsense to make money and profit and benefit from people's ill health. And importantly, we are seeing every day, every hour, every minute, how it is being used for the pursuit of power and wealth. And what has become a casualty in there is truth and the declining influence of science. I think I'll skip this example and go straight through to the point I wanted to make. After 20 years of incredible, inspirational investment that the US made through PEPFAR, in a matter of days, the PEPFAR programs were shut down. Now, I don't see aid as a forever story, but there is a way in which you exit. And you don't wake up one day in the middle of trials that are in the field to say, oh, too bad, you go do whatever. We've had to, as South Africans involved in research funded by the US, marshal funds to ensure that we deal with participants in trials in a responsible way. Our government had already invested quite a lot in terms of treatment provision. But we've now moved from that destruction mode to a new mode of extraction. And I want to give you some flavor of that extraction. There are bilateral discussions taking place. And there are at least 11 African countries that have committed to this. And what have they sold in the process? This is not about extraction of natural resources and rare metals. This is about data. This is about information. And our governments that have signed these bilateral agreements with the Trump administration have not sold just our futures, but futures of generations to come. It is about data that compounds and never runs out. It's about AI systems that feed into new product development. But the concern is how much of this data can be turned around and translated to direct power from one state over another. In the beginning days of this year, we saw how the president of Venezuela was captured. Those are just glimpses of what is to come. To accumulate wealth and power, you have to hide truth. In captured states, and we know this in South Africa because we're still living through state capture, the truth is more than inconvenient. And the three prime targets are truth-sayers that are seen as enemies. That includes the media, and independent media in particular, not propaganda machinery, legal systems, your judiciary, and intellectuals or scientists. And I'm going to add a fourth target, which we've seen increasingly, is citizens who stand up for what is right. And that's not just happening in the US, that's happening in many authoritarian states across the globe. What can we do? Recognize and understand the problem, appreciate the role of scientists as truth sayers who need to ensure that truth holds supreme, and we are the trusted voices. We need to continue to fact-check official government communications and support independent media. There's no freedom without free press. We have to rebuild trust in science, effectively communicating science, promoting public understanding of science, and standing up for science. Every bit of resistance helps, even if it seems insignificant. And I must say this as an anti-apartheid activist, and there's several of us here in the room. We never thought in the 70s and 80s that we would see democracy in this country and a peaceful transition to democracy. And here we are today. Every little bit counts. It may not pay dividends today or tomorrow, but it all adds up. I'm going to end by saying that as we gather here and think about equitable partnerships, we have to think also about global scientific innovation and excellence, how we strengthen science diplomacy, how we protect academic freedom, how we engage all regions in knowledge pursuit, and build a truly scientific ecosystem. For humanity to progress, science must be truly global and benefit everyone, every way. I thank you for your attention.
Thank you so much, Prof, for that illuminating presentation. I think what is quite important from your presentation, particularly on the issue of equitable partnership as a strategic necessity, in the context of who sets the agenda, in the context of how those partnerships are governed. I think in South Africa, at the height of COVID, we were able to really live through what you just explained in your presentation. Once again, Prof, we would like to thank you for a very illuminating presentation. Unfortunately, due to time constraints, we will not be able to take questions. However, I do implore the participants to engage Professor Karim during our tea break and hopefully also during our lunchtime. And thank you so much, Prof.
Thank you.
Can we just give a round of applause to Professor Karim? What I'm going to ask you now to do is to do this in the next 6 minutes or so. I apologize for putting pressure on you because we want our next sessions to start at exactly 10:10. So you have about 5 minutes and a couple of seconds to make your way into the respective sessions. Please do look on your program as to which session you ought to be at. What I also want to indicate is that tea will be served after the session. And also I want to just re-emphasize for those who will be presenting posters during tea time, please make your way to the exhibition hall to put up your posters. Ladies and gentlemen, thank you so much.